Over the past 20 years, nursing education has moved away from theory and more towards checkboxes and real-world clinical practice. While clinical guidelines are essential, nursing theory remains the true bedrock of the profession, explaining the science and critical thinking behind what nurses actually do. Yet in many advanced clinical programs today, this vital subject has been pushed to the background and become almost invisible. Welcome to Teach Well, Learn Well, a podcast series highlighting the scholarship being published by members of the University of Tennessee Health Science Center's community about effective ways to teach. In the first of a two-part series, we talked to four of the authors of the paper titled Exploring Nursing Theory Convergence in Doctor of Nursing Practice Education. I'm joined by Drs. Marie Gill, Janet Tucker, Laura Reed, and Rhonda Johnson, who along with Sharon Little, Jacqueline Sharp, Michelle Ricard, and Amanda Mathey, published this paper in the December 2025 issue of Advances in Nursing Science. In these two episodes, we explore the concept of nursing theory convergence, a framework designed to bridge the gap between abstract academic knowledge and real-world clinical practice. Join us as we discuss how mastering this language of theory and action helps nurses advocate for their decisions, build interdisciplinary credibility, and ultimately deliver better patient outcomes. Marie, welcome.
Thank you. Glad to be here, Tom.
Glad to have you. Janet, welcome back to you.
Thank you, Tom. Looking forward to our discussion.
And Rhonda, welcome to you.
Hello, Tom. I'm looking forward to this discussion as well.
And finally, Laura, welcome back.
Thank you for the invitation to come back.
I am really excited about this article. I enjoyed reading it, and I'm a theory geek. So when we start talking about theory, I am all in. So Marie, I'm wondering if you could just start us out and briefly summarize your paper and why this topic is important to you.
I want to answer the question a little bit in reverse order and talk a little bit about why the topic is important, and then give you a summary of the article itself. The short answer of why it's important is that theory is the bedrock of our nursing discipline. Theory in itself is the why behind nurses do what they do. And yet, over time, I would say probably nearly 60 years, nursing theory education has really kind of ebbed and flowed. And most recently, we've actually seen some issues with theory education and D&P programs becoming almost invisible. And that's concerning to us because nurses really are part of the care providers, those who have a D&P who are working as nurse practitioners or other advanced levels of nursing are the ones really engaged with patients frequently. And if in their role as providers, if you begin to lose the sight of nursing theory, then it kind of has an impact on how we develop nursing knowledge and maintain the nursing component in the provider role. And so that is a concern. And theory is a part of both of those areas. The shift away from nursing theory being taught really was more pervasive than what we anticipated. So there was this big wave of interest in evidence-based practice and quality improvement. There was also a wave of technology, which was fantastic, but the technology kind of began to lend itself towards more of a checkbox nursing approach instead of theory-based or theory-informed practices. And quite honestly, it's just, I don't know, sometimes people think it's just a little easier to lean into that checkbox nursing because it tends to be a little bit more straightforward and one and done, and here you are. But in that movement, we began to see some problems because new nurses were beginning to have trouble understanding the why behind what they do. Again, that's the whole portion of nursing theory, right? And curriculum is just packed. And there is the perception we just don't have time to talk about theory or to teach theories. When we began to think about nursing theory and all this importance, we started talking about how is it that nurses kind of really kind of know what theory is because they see it in their practice, but they just don't know what to call it, or they don't know how to talk about it, or they don't know how to say, yes, what I'm doing is actually backed by theory. And so we came up with this terminology, nursing theory conversance. And there really wasn't anything in the literature at all about this particular concept. I mean, there were things talked about communication and all kinds of things like that. And nurses are all about communication. And there were some things about languaging and terminology, but nothing about like what we were talking. So, one of the things that we did with our paper is we made an attempt to give a preliminary definition of nursing theory conversance based on our own understanding and looking at the literature. And so our early definition really is the ability for nurses to understand, articulate, and apply theoretical concepts effectively within their practice. We see nursing theory conversance as a proficiency or skill development. In other words, nursing theory conversance is not a one and done achievement. It takes practice and development over time. And we began to map out what we thought, actually drawing what does nursing theory conversance look like. And we decided that it is a multidimensional construct that includes not only all of the theoretical and empirical and experiential knowledge that we see in nursing, but it also includes the communication, the vocabulary, the language of what we call theory in action. There's a fluency associated with nursing theory conversance. There's this theory literate practice and a comprehension. As we looked at all of these things that we believe that nursing theory conversance is, one of the things we said it is not, other than it's not a one and done achievement, we also said that becoming nursing theory conversant does not mean that a nurse has a comprehensive knowledge of all nursing theories and that they can just go in and select a bunch of nursing theories all at once. That's really not the point. A nurse who is nursing theory conversant, they know how to apply theory in a nursing situation for the care of an individual patient or for a group of patients. So our paper really unpacked all of that definition, and then we began to explore a little bit more about the practicalities of nursing theory conversance and offered some reasons for integrating nursing theory conversance in the development of DNP education and what role that might have. We explored some of the challenges of nursing theory conversance in DNP education. And of course, we looked at future opportunities for nursing theory conversance and how we might see that integrated into curriculum.
Thank you for that overview. So, what does it look like for a nurse to be nursing theory conversant in everyday practice?
Whether it's a nurse at the bedside or in the outpatient setting or a nurse practitioner, when you're in practice, if you're able to plan care based on a theory and then also describe that care and why it's based on a theory, a lot of nurses we've discovered their practice is based on theory, but they really can't identify it and articulate it. So, a big part of that is being able to articulate what you're doing. For example, let's say I have a patient that is a newly diagnosed diabetic patient, and maybe the nursing assistant, or it could be any other member of the team, comes up to me and says, this patient is so angry. Every time I go in his room, he's so angry, no matter what I say. I can then share, well, based on what we know about grief and loss theory, Dr. Kubler-Ross, people go through a period of anger when they lose something. And when you are diagnosed with a chronic disease where your life is suddenly changing, you have to change your diet, you have to check your blood sugar more than once daily, and you may have to be learning how to use insulin and how to administer that. And so understanding that that anger is very normal and it's expected part of this process, but being able to articulate that to the team member and then also talking about, is this the best time to try to teach this patient when they're really in the midst of anger and this new diagnosis? But also, I think about that next day or a few days later when that nursing assistant may come up to me and say, he's not angry anymore. He keeps asking me questions. He's wanting to learn. We can then talk about, okay, he's moved into the next phase. Might not quite be total acceptance, but he's trying. So when you get to talking to nurses and they may initially say, I don't know that I use theory. What are you talking about? It's in the back of their mind. Dr. Gill and I have discovered that sometimes the more you talk to a nurse about theory, the more she starts identifying, it may be way back there, but they start identifying that, oh, well, yeah, that theory, I remember that theory. We learned that in school. And so to be nursing theory conversants is really making that connection and being able to articulate it from that head knowledge to practice and planning care.
Marie, you talked about communication as part of your introduction, and it sounds like to me what you're saying is that using theory as part of when you're trying to make a case for something, it adds credibility to what you're talking about because it's not just, well, I saw this, I learned this, but being able to point to specific evidence on what you're trying to argue. And it seems like that's not only probably to, you talked about nursing assistants in your example, but I can imagine when you're talking to patients or you're talking to doctors or other healthcare providers, using that evidence, that theory as part of your argument probably strengthens what you're trying to say. I remember early on when I was working with the nursing program when I first came to UT, I think Rhonda Johnson told me that one of the things nurses need to be able to do is be able to advocate for themselves when they're making an argument. And it sounds like this is one way to do that.
Absolutely, because if you were having that conversation with a medical student, an intern, or resident who is just in that midst of learning the different professionals they'll be working with, they would walk away like, okay, well, she's not just doing something because someone told her to. She's basing her care on science, on theory, and they can see that that critical thinking is occurring. I would hope. So.
You talk about that while doctors of nursing practice programs are growing, the curriculum heavily centers on evidence-based practice, quality improvement, and leadership. And it kind of leaves nursing theory scarce or invisible. Why do you think nursing theory has been pushed to the background in these advanced programs, and what's lost when you ignore it?
We have focused so heavily in the DMP programs that we're training providers, advanced practice providers, that we have kind of moved away from the nursing part. We're really focusing more on teaching students to be providers, looking at the guidelines, evaluating, diagnosing, and treating a patient. We kind of left that out because of the rapidity that we have to get these students through these programs to get them out and to get them practicing to provide the medical care in our communities. I think we've moved away from, oh, we'll have theory as one course, teach that course. Okay, now that was in the beginning of your program, move on.
I had never thought of the point about you trying to get these students through. There's such a shortage of nurses, and students are giving pressure to try to get through quicker to save costs and everything. And so, yeah, I can imagine that that rapidity that you talk about is a strong reason for this happening.
And Tom, I also think that part of the dilemma that we have and this may not be popular to say, but we're also competing state universities and colleges of nursing affiliated, like with University of Tennessee or other universities in the country, is that we're competing with for-profit institutions. And when we compete with for-profit institutions, even though they may meet the same accreditation standards, they are weeding down the number of credit hours in order to graduate. So what gets cut? It's going to be what they would consider non-essential learning classes, such as nursing theory. So we're going to have to be creative as we narrow or shorten the amount of credit hours to figure out a way of incorporating that within our, and I teach mostly at the graduate level. Theory is important. I remember in my BSN, I remember it in my master's, I remember it in my DNP, and I'm not that far out from my DNP. So I think it's an important attribute, as Laura and Marie and Janet have so far said.
I love the term theory hesitancy, which you liken in your paper to imposter syndrome, where nurses doubt their ability to grab abstract theoretical concepts. What are some effective ways that mentors and educators can help nursing students overcome this fear and reluctance? And I'm wondering, just something else occurred to me is maybe the move away from theory is also because I used to teach statistics. And when people hear math, they sort of freeze up, say, I don't want to have anything to do with that. And I wonder if being able to pull away from theory makes more students attracted to the field and talking about theory all of a sudden, so that people say, well, I can't do theory.
Yes, that's a great point, Tom. I work in theory and in research, and either one of those words will just clear a room in an instant. You know, oh, it depends upon what room you're walking into, I guess. But people sometimes are thinking maybe that's not the route they want to travel down, but it's part of what we do as nurses. So, this idea on theory hesitancy, I got to thinking, we certainly did talk about it being like an imposter syndrome. But later, after we published the paper, I started thinking about how whenever you might have some fluency in a language other than your native tongue. I mean, there's some other language that you've learned. Maybe you learned it when you were in college or high school, and then you get the opportunity to use that language, whether you have traveled out of the United States or you're visiting a restaurant of a cuisine where there may be people speaking a different language, and you're just so eager to try out a few words. But you're so afraid you're going to make a mistake or you're not going to say it right or you're going to offend somebody. So you're hesitant. And I kind of thought about it that way too. It's kind of a combination of imposter syndrome and then also having this hesitancy of getting something wrong. But in terms of what we can do with mentors and educators to help students overcome this fear and reluctance, I think we have to start with the faculty first. I think that faculty also have this embedded fear and hesitancy about theory for the same kind of reasons, Tom, you just described about statistics. You know, some people just like the hair raises on the back of their neck when they hear those words. And in terms of theory, I think we also have to recognize, as we talked about the pivoting across the 60 years that I mentioned about nursing theory education, I will tell you, not everybody received the same kind of nursing theory education. Even if nursing theory was in a course, it doesn't mean that it was taught well. And that's no disrespect to my colleagues who have taught before or who are teaching now. It's in the literature and in another study that Dr. Tucker and I have been doing, we have also found that however the instructor, faculty, teacher, however you received your theory education is how you begin to value it, whether or not you have fear about it or you have hesitancy. So I would start with the faculty and find some very brave spaces where people can feel very comfortable in airing how they feel about theory, how they were educated. Do they ever use theory? Do they understand theory? And just have a really, really heart to heart dialogue on it. I think that we have to get it out in the open first if we want to move forward and help students. So that would be the first step. But once faculty kind of make a connection with their expertise and come to grips on how they feel about theory, then as we start teaching students, I think it really is a lot about how our attitudes about theory are presented to students. And we have to give lots and lots of examples because theory is somewhat abstract. And yet, I have heard recently by Dr. Peggy Chen, she was talking about theory, and she is a notable nurse theorist, that she said recently, if we want students to learn about theory, we just have to teach them. In other words, you can teach theory, but there's a way to go about it. And that's how you really see theory in action when you are caring for patients. And even, Laura was talking about examples because that's what students really relate to. And you almost have to take their hand and show them how everything is connected. And sometimes that can be in a didactic learning situation, classroom. But it can also be in a simulation lab or in some type of a debrief following a clinical situation. Or for DNP students, at some point they have some follow-ups with their mentors and they can have a conversation about that. Even if it's just a matter of walking, well, tell me about your day and what did you observe and Well, what made you think about that? And well, how did you approach it differently as a nurse? What is your lens? How do you see this problem? How can you help this patient? We know what the diagnosis is, but what else is going on? There's got to be 100 different things that we could talk about. So I think that overcoming the fear of using theory and that theory hesitancy comes with earnest practice, just being able to have conversations about it.
It relates to adult learning theory, right? Is tell us not only what we need to know, but why we should care about it and how we're going to apply it to our jobs.
Precisely. What a great way to weave theory back into this conversation. Love it.
And I will have to admit, I am the definition of theory hesitancy. 2 years ago, if you had said theory to me, I probably would have cried and shut my door because my experience with theory was not good. I mean, I learned it as an undergraduate. Here it is, learn it, memorize it, move on. Same in my master's and my DNP program. Back in the olden days when I got my master's, I had to do a thesis and I had to pick a theory and I had to use it in my research, but that was it. So Rhea and I started having a conversation about theory hesitancy. I was like, oh, not theory, Marie, you're talking to the wrong person. So the more she and I had conversations and we started just talking about theory, it dawned on me how I do use theory. I use theory to teach students. I use theory when I'm developing treatment plans for my patients. So we have to acknowledge it, call it what it is, and weave it back in to what we're actually doing. Use it like we know it and call what we do theory-based.
Laura, I remember those doorway conversations that we would have. And I will have to say that Laura literally has to walk right in front of my office to get to her office. And my door is always open. And so I don't know if she tried to tiptoe or do the 100-yard dash to get to her office. I'm not sure. But one day we just started having a conversation because I was so interested in how she saw theory and what she saw as a nurse practitioner. And seriously, just like she described, as soon as she talked about it, as soon as our conversation started, it all came out. I mean, here she was talking about it. And I said, that's theory. And she said, well, I guess that's right. And it was a great conversation. And now she's a theory champion, as well as Rhonda and Janet are certainly nursing theory champions.
I was probably hesitant, but I did teach theory at the master's level at a different university. And I remember that same feeling of being like, what did I just get assigned to? Why? And I would think, why me? And then I figured out, well, why not me? And as I dove into teaching the master degree students, I thought, I think the way to do this is to start small, right? Break it into what are they interested in? What is their passion? And then find a concept and then find that grand theory that's out there, right? And how that all connects together so that they can reflect backwards on how they can apply it. And I think if we can try to remember in the DNP program that they do get a theory class, but we need to, as faculty, embrace what they've learned and then try to implement that, whether it's their didactic work, like in the nurse midwifery program, and how they're applying it in their clinical practice. And I have tried doing reflections with my DNP students, like, why are you thinking this and this? And if this situation happens, sometimes I'm successful and sometimes I am not, but I keep working on that part of it. So I think if we have them learn it and then keep applying little pieces of it, I think they will then make more sense to them.
And that's this month's episodes of Teach Well, Learn Well. I'm Todd Lochner of the Teaching and Learning Center at the University of Tennessee Health Sciences. Join us next month as we continue our conversation.